Good evening and welcome to our COVID-19 update. I'm Ladi Akiridoluale. Here are the highlights at this hour. Federal government invites small and medium enterprises to register for 75 billion naira survival payroll scheme fund. Ahead of the resumption of some primary and secondary school classes in Lagos on Monday, preparations to receive the students are said to be in top gear. And Prime Minister Boris Johnson warns UK citizens that another lockdown may be inevitable to curb a spike in COVID-19 cases. The federal government is committed to creating an enabling environment to help Nigerian businesses get back on track following the impact of the COVID-19 pandemic. And that's according to the Vice President, Professor Yemi Osinbajo, who says that the micro, small and medium enterprises are being offered the assurance that government's economic sustainability plan is still very much on course. He was speaking during the virtual commissioning of an MSME facility in Lagos.
This year, 2020, has been a difficult one for the entire world as a result of the COVID-19 pandemic. And it, of course, has been a very difficult one for Nigerian businesses as well. Businesses, small and large, have been significantly impacted by the disruptions. As you all know, MSMEs are the engine of the Nigerian economy. When they thrive, the economy thrives. When they struggle, the economy struggles. This is why the federal government is deeply committed to ensuring that we incrementally create the best possible environment for MSMEs to do well. The administration is doing this in various ways, from improving access to credit through the central bank, Development Bank of Nigeria and the Bank of Industry, and others. Several of our development banks and several of even our commercial banks are being committed to ensuring access to capital for small businesses. And there are several initiatives that have also supported small businesses in various ways. For example, our Finance Act has exempted businesses generating less than 25 million naira in annual turnover from companies' income tax. Those with a turnover of between 25 million and 100 million will only pay 20% in corporate income tax instead of 30%, which was the former rate payable.
And speaking about that commitment and the access to credit, the Small and Medium Enterprises Development Agency of Nigeria, SMEDEN, says it is set to open registration sites for MSME's Survival Fund Payroll Scheme next week. To guarantee the takeoff of the scheme, which is going to run for 3 months, the federal government says it has rolled out 75 billion naira to curb the effect of COVID-19 on small businesses. The Director General of SMEDEN, Dr. Diko Rada, disclosed this in Katsina during the closing ceremony of the Entrepreneurship, Vocational Development, Training and Empowerment Program under the National Business Skills Development Initiative. Implemented in 11 states with a total of 1,397 beneficiaries, the empowerment program is out to provide entrepreneurship and vocational training, as well as offer entrepreneurs empowerment materials to enable them improve on their businesses. The benefiting states include Katsina, Rivers, Delta, Ebonyi, Adamawa, Niger, Lagos, Kwara, Bauchi, Zamfara, and Ekiti.
Especially the federal government under the leadership of President Muhammadu Buhari. I have just mentioned it in my speech that in the next coming week, a registration site will be open for MSME Survival Fund Payroll Scheme, as well as Guarantee Takeoff Scheme, that government has rolled out 75 billion naira to curb the effect of COVID-19 on MSMEs, and the program is going to run for 3 months. What I'm calling on Nigerian MSMEs is to ensure that they roll into the program, register and benefit from this palliative of the federal government. But you can achieve getting the accurate data and taking a general census of MSMEs in the country. The reason for doing that are many. One of the reasons was to ensure that we have this database to enable the government to plan very well on their activities on MSMEs. And apart from planning, you can be able to use that data either by the state, local government, or any development partners, or any NGO that wants to use it, can go into the database and know the locations of those MSME, what they do, where they are, what are their activities, what kind of services they provide.
In what might be some cheery news, the Nigeria Institute of Medical Research in Yaba, Lagos, says it has developed molecular test kits for COVID-19. According to developers at the Research Institute, the kit gives test results in less than 40 minutes. They call it the SARS-CoV-2 Isothermal Molecular Assay, SIMA. According to the Institute's Director General, Professor Babatunde Salako, the test kit is for COVID-19 detection and is Nigeria's first molecular testing kit for the contagion.
It's a question of having your money and buying the isothermal PCR, which at the time we bought the one that we used for this test was around $10,000 compared to the real qPCR that the bigger laboratories are using that may cost up to $100,000. Although it depends on the number of tests that you want it to be able to do. Even then, it cannot be less than between $50,000 and $100,000. Now this will just be $10,000 and can do 32 tests in less than 40 minutes. So it's something that will be very useful for those hospitals, and I believe they should be able to invest in such things. 500 kits. This is low because in the past few weeks when we were trying to develop this, we had issues with transportation. There were international lockdown, the planes were not flying, and bringing some things to the country became very costly. So we had to wait. In fact, there are some of our enzymes that we are still expecting that have not come. Given the current situation where we cannot get what we want, we should be able to produce as much as possible. But our aim really is to make it very fine and then get someone to take it over from us.
In Ogun State, in Nigeria's southwest region, students of tertiary institutions are preparing to resume academic activities. And a one-day sensitization on COVID-19 has been held for school administrators to be on the same page on the control and management of the virus. At the event, which held at the Government House in Abeokuta, students were asked to take responsibility to halt community spread. Students of 13 higher institutions in the state are also expected to reopen their various campuses on the 21st of September.
It's been 6 months since all educational institutions were shut down by the state government as one of the measures to reduce the spread of COVID-19. Present here are students' representatives drawn from the 13 tertiary institutions across Ogun State. This call became necessary as plans are on to reopen academic activities.
I implore you all, as student leaders, to listen attentively to the resource persons so as to prepare yourself as worthy ambassadors and campaigners against COVID-19 pandemic as you return back to your respective campuses so that we all can make the gateway state free of COVID-19 in shortest possible time.
They have been sensitized on how to curb the spread of coronavirus, its debilitating effects on human activities and socio-economic development, and the need to ensure strict adherence to safety protocols.
Major responsibilities are that they should identify the signs, early signs. They should know that the COVID-19 is not a death sentence. They should not stigmatize anybody that is COVID-19 positive. They should, as much as possible, also be able to support their trainers and all that when they make requests for smaller numbers of people in classes and physical distancing, and also to ensure that as many people as possible they can do the risk assessment and modify as much as possible.
The state has recorded 1,756 cases with 28 deaths, while about 2,334 have been discharged so far.
In the meantime, while schools in different states prepare to resume on Monday, September the 21st, in Ebonyi State, the government there has announced October 5 for schools reopening. Its Commissioner for Education, Dr. Onyebuchi Chima, discussed this after the State Executive Council meeting in Abakaliki. According to him, primary, secondary and tertiary institutions will resume on October the 5th, while nursery schools and creches will not be reopened till the year 2021. On Monday, September the 21st, schools in Lagos State will be reopening their doors for students after being closed for 6 months as a result of the COVID-19 outbreak. Some of the public and private schools visited had the school authorities saying they were ready for resumption and will not jeopardize the students' health for any reason. Our correspondent, Titilayo Aberewo, tells us more.
This school gate, like many others, have been shut for the past 6 months for a reason known to all, the COVID-19 pandemic. Things are about to change though. The quiet environment will be receiving students in phases, beginning with JS3 and SS2 students. At Oregun Junior and Senior High School, the school management says all necessary measures have been put in place for resumption.
We have banners to sensitize the students. As JS3 students are resuming on Monday, the teachers have prepared their lesson notes and everything. We're going to do thorough revision.
For now, no assembly. And our classes, we have made them that there's spaces.
The story is pretty much the same at the Okpebi Senior and Junior Grammar School, where every visitor is greeted with the measures already put in place by the school authorities.
You can be telling them what you expect.
The private schools are also not left behind. Some of those visited on the mainland appears ready, while some will be adopting resumption in phases. Others say the entire students will be resuming on Monday.
This section right here, we have a capacity for over 300 children. But because it's a new premises for us, we're going to be starting off with about 30 on Monday. My message to the parents is that we, school administrators, school staff, we are not cutting corners when it comes to the safety, the health and safety of our children. That is paramount to us.
The children cannot be in school all day. Come in on Monday, Tuesday you evaluate yourself, you do online, come in on Wednesday, and then you evaluate again on Thursday, then you come in on Friday. And following, of course, the directives of the Lagos State. And then children will be able to be online and then replay, revisit, now go into research of everything they have learnt in class.
Everyone is resuming on the 21st, all classes. We have enough room for everyone. We have observed social distancing. And what we have done is we have extended where we normally use as classrooms, even as far as the school halls. We have involved the halls as places for students to sit and use as classrooms.
For some students who have just concluded their National Council examinations, they are also conscious of their safety and eager to return to school.
I would love to tell my other colleagues to practice social distancing, as he said, and to always wash our hands frequently, no matter what, and avoid hugging people.
As things stand now, it appears all is set for school reopening on Monday. But parents have been advised to educate their children on the need to stay safe and see an end to COVID-19. Titilayo Aberewo, Channels Television News.
Let's talk to consultant public health physician, Dr. Abi Abraham, who joins us via Skype from the Isolo area of Lagos. Dr. Abraham, thank you for your time. Welcome to the program.
Thank you very much.
I'm going to take it in reverse order. Let's start with the most current thing that we're taking a look at today, and that is the preparedness for schools to resume, particularly in Lagos on Monday, primary and secondary schools. From everything you've heard, everything you've seen, and everything that's been reported, are you confident that come Monday, things will go very well?
I think there has been a concerted effort by the Federal Ministry of Health, the Federal Ministry of Education, the NCDC, the UNICEF, and lots of agencies and stakeholders. They have made a big effort to come together, quite, preparing in advance for this day. I mean, I think the preparation, they have this massive document and they have set out implementation plans, and they have actually cascaded these plans to the schools, to the principals, and also to the teachers. And I do believe that quite a number of the schools are they're prepared for Monday. Yes, so I do believe that a lot of them are prepared, because I have seen some of the preparation, and it's good. There's a lot of work that.
I'm sorry, I keep trying to jump in, but for many who have been worried about primary and secondary schools, it is particularly because the pupils at these levels of education are less amenable to control, to remaining in one place, to obeying protocols such as keeping your masks on for lengthy periods of time and not touching each other and so on. I think that's the part where many believe there might be a question mark. What do you think?
Well, there is a real balance between keeping the children at home. I think we need to be aware that a lot of children have suffered. Their education has really suffered. What has been happening is that there's a divide between the children whose parents can afford school fees and the parents whose children cannot afford school fees. And so what happens is that the parents whose children can afford school fees, which is a small percentage, are very they go online, they do lots of online education and things like that. But on the other side, we have the children who have not accessed education. Now, it is just the balance, because a lot of these children are exposed to domestic violence and other forms of violence. And so we have the domestic situation on one side, and then we have the health situation on the other side. I think the good news about it is that, to be frank, it's not just the children that need to be protected in the school, it is the adults. We know that children are by and large, not very, very affected by COVID. There's a tiny percentage that have severe disease, but by and large, it is usually even the adults who are going to teach them, who also need to be protected. So it is really a balance, and everybody has to be involved in educating the children. So it is not only the job of the teachers. I'm aware that some teachers and some schools and proprietors have been sending information to the parents to start to sensitize them to this. And so it is going to be a balance between, should we leave the children at home, and should we keep the children just sitting down there without education, because most of the children are not able to access radio, online, and things like that? Or do we safely and cautiously bring them back to school, making sure that there are certain checks and balances in place? So I think really it is just that, and we're going to tread the path of caution for quite a few weeks and months to come.
We'll take a short break, Dr. Abraham, and when we come back, I'll be asking you about the preventive protocols themselves, as well as this new test that has just been developed that can bring out results in 40 minutes, and what that could do for our testing program in the country. Please stay with us. That will be after this break. Welcome back to our COVID-19 update. Before the break, we were talking to Dr. Abi Abraham, a consultant public health physician. She's still with us. Dr. Abraham, before the break, I did say that when we return, I'll be raising two major issues. The first, of course, is the protocols themselves within the schools and how quickly and easily it is going to be make it possible for those involved to comply. I know that some of the protocols that were put in place, including having a holding room for students who display symptoms, doctor and nurse in residence in many of the schools, as well as washing places, infrared thermometers, and so on. How easy is this going to be to comply with?
I believe it's going to be a learning curve and a steep learning curve. I am aware that quite a few teachers, not all the teachers, but quite a few teachers and the principal have started to really train their staff. There are actually some easy protocols that have been put into place. Like, for instance, the adequate physical distancing. That is, it is something that has been drummed into us over the past few months. And it's simple, really, because children are being told, teachers are being told that the students have to be at least 2 feet away from each other. This means that obviously the class cannot be full. And so they have given them alternatives to physical distancing, like, for instance, alternate attendance. So every student doesn't need to come to school in one day. So you can stagger it. You can say JS1 comes today, JS2 comes tomorrow, and JS3. And then you can do a mixture of blended learning so that there would still be a little bit of radio learning and TV learning for those who can afford it and who already have it. But for the others, they would have homework and things like that that could be done within those days where they have not been at school. And also for schools who can afford it, they have been advised to do things like canopies. So, you know, within the open air, it is very, it's much less. The tendency to catch COVID in outdoors is much less. And so teachers are being advised to have canopies, if possible, where they can also teach the children. So the phased return also is a good one because you face the return, and so you say 2 years are going to come 1 week, and then 2 years are going to come the next week. It is a lot of organization. I do agree with you, but I think when there's a will, there is a way. We are all now in a situation where everybody in the world has changed their mode of practice. And I don't think the education sector should be left out of this. So I do believe that it will take a bit of learning, especially like you rightly say, these are children. It will take a bit of learning, but in the end, it will become the normal for the children. So if there is a big will by the student, by the teachers and the proprietors to ensure that these protocols are instituted and implemented, then I believe there would be some success there. But like you rightly, indicated, the implementation is really the issue.
All right, then let's talk a bit about the issue of test kits. One of the other issues that has come up with COVID-19 case management in Nigeria is the fact that the numbers have been dropping for a number of weeks now, but so many people have said they are not dropping because we now have a handle on the COVID-19 virus itself. They are dropping because we are not doing testing. A lot of states, local governments are not doing testing in their jurisdictions. Today now, the Nigerian Institute of Medical Research in Yaba says it has developed a COVID-19 test kit that can get the results out in 40 minutes, which means you can go there, take the test, and get your result while you wait. Do you think this will have any impact on the capacity or the ability of people or the willingness to present themselves for testing?
Well, I should think so, really, because it's the Nigerian Institute of Medical Research. It is a locally developed test kit, and I think they're still working on the specificity and the sensitivity. If you are told that you can come in and have a test and have the results done in 40 minutes, results in 40 minutes, I do believe that there will be a bigger uptake of the test. Now, anecdotally, it's not really because people did not want to get tested. There are many other factors that have to do with our testing capacities. And some of them is what NIMR is bringing into the equation. The fact that they know that our capacity, we did have a bit of a shortage of test kits, even though that is now improving. So it is really about increasing the capacity for testing, for test kits. But the curve is actually flattening. That is actually statistics. It is definitely flattening, and it is going on the downward spiral. Having said so, still a lot of caution. It is still out there. We're having cases every day. So every single protocol in terms of the hand hygiene, the physical distancing, the emergency protocols all need to be adhered to very, very, very strictly.
Indeed, Dr. Abi Abraham, thank you so much for your perspective and your time on the program tonight.
Thank you.
The latest report by the Nigeria Center for Disease Control, the NCDC, shows 131 new cases and 2 deaths in 24 hours. The new cases are reported from 17 states and the FCT. Lagos, with 45 new cases, is the highest. Kaduna and Plateau have 17. The FCT, 16. 6 new cases were recorded in Delta and Niger states. Kwara had 5, Oyo 3. Akwa Ibom, Cross River, Ekiti, Enugu, Osun, and Sokoto recorded 2 new cases, while Bauchi, Ebonyi, Katsina, and River State have 1 case each. With just hours to the governorship election in Edo State, the Independent National Electoral Commission, INEC, has reiterated the method of voting that will hold sway tomorrow in complete compliance with established COVID-19 protocols. Briefing journalists in Benin City, the INEC Resident Electoral Commissioner, Mr. Johnson Alalibo, also clarified other issues with regards to preparations for tomorrow's election.
As we started preparing for the elections, INEC, in its wisdom, developed a guideline on conducting election under the context of COVID-19. And that guideline will guide us on the safety of both personnel and voters. And we have done enough to sensitize all our stakeholders and the voters on the guideline. First, on how we are using face masks. Is compulsory for both the personnel and the voters. And we are using sanitizers to sanitize our smart card readers. We also have methylated spirits to clean it, our smart card reader after each use. We also have told the voters that you are going to have 2 queues, the inner queue and the outer queue, and we are going to maintain physical and social distance of 2 meters or 6 feet. And the inner queue will have maximum of 20 persons at a time. So these are some of the measures that we have put in place to ensure that we are safe while we vote for this governorship election by tomorrow.
INEC's Resident Electoral Commissioner in Edo State, Mr. Johnson Alalibo. Moving up north to Plateau State, where the government there says it has committed the sum of 366.5 million naira to the fight against COVID-19, says the first index case was reported 6 months ago, with the figure rising every day amidst measures and directives put in place to curtail the spread of the pandemic. Governor Simon Lalong stated this at the COVID-19 engagement parley with traditional rulers and local government chairmen at the Government House in Jos, where discussions were held on how to curtail community transmission.
April 17, 2020 remains fresh in the mind of Plateau State residents, a day that the first case of COVID-19 was reported in the state. 5 months after, the figure has risen to 3,175 cases, with 2,222 recoveries. Presently, there are 913 active cases, with some on admission at treatment centers and others being managed in their homes. Sadly, the state has recorded 31 fatalities. With increasing figures and community spreading now prevalent in the state, an interface between the government and traditional rulers, as well as local government officials, becomes imperative.
We need to curtail further spread of the disease by engaging our people to take personal responsibility for their health and the health of others. Many people are not using face masks, washing their hands, or maintaining social distance. As royal fathers, we expect you to lead in the next phase of our advocacy and sensitization to attain better compliance, particularly now that we are witnessing the opening of more sectors of the economy. We need to wake our people from laxity. It is important to note that COVID-19 is not over yet.
The renewed efforts in enforcing protocol requires the support and cooperation of community and traditional rulers in overcoming the challenges, especially now that schools are set to reopen for primary and secondary school students.
We have trained teachers and principals, disinfected schools, and established task teams towards ensuring that all laid down protocols are observed. Once we finish with exit classes, we shall gradually cascade to other classes within secondary and primary levels. The success we record at these levels shall determine the reopening of tertiary institutions, all in a bid to guarantee the safety of our children and avoid resurgence.
The government is optimistic that the engagement with traditional rulers and community leaders to ensure enforcement of protocols will help spread the message for all to take personal responsibility for their health and hold others accountable for the safety guidelines.
Meanwhile, the United Nations Resident and Humanitarian Coordinator in Nigeria, Mr. Edward Kalon, has been speaking on the decline in the number of confirmed cases of COVID-19 in the country. During a meeting with the governor of Borno State, Umar Zulum, he said the decline is indicative of a collapse in demand for testing. Mr. Kalon believes that community transmission is already ongoing, urging the government to intensify campaigns that will ensure compliance to safety guidelines.
This pandemic is going to be with us for a long time until a vaccine is found. Don't even start talking about the politics of the vaccine, which you are all familiar with every day. The decline in the number of confirmed cases is indicative to us as a collapse in demand for testing, and from our analysis has not got anything to do with containment of the virus with ongoing community transmission. I call on Your Excellency and members of the Executive Board to lead by example in containing the virus and hold institutions and organizations accountable to ensure compliance with the non-pharmaceutical measures. I am on this mission with the WHO representative, and the advice of WHO to governments and people is clear, and I quote, Your Excellency: test, isolate, and treat COVID-19 patients. Trace and quarantine their contacts. Inform, empower, and listen to communities. Keep physical distance, wear a mask, clean hands regularly, and cough safely from others. WHO has also gone further and advising governments to tackle the pandemic. They are urging us to focus on 4 priorities. 1, prevent amplifying events such as large crowds or crowded places. Empower people to protect themselves. Focus on public health basics and protect the vulnerable, including older people and those with underlying conditions.
In the South-South, the Bayelsa State Police Command is partnering with the government to achieve results in curbing the spread of COVID-19. Let's hear more from our correspondent there, Dobra Timenwood.
Aside members of the Bayelsa State COVID-19 Task Force, the Bayelsa State Police Command says they are working in partnership with the Bayelsa State government to ensure the residents of Bayelsa State are held by the NCDC guidelines to ensure that the spread of the coronavirus in the state is reduced to the barest minimum. We spoke with the Commissioner of Police in the state on measures he has put in place to ensure that residents of Bayelsa State adhere to these guidelines, and here's what he said.
Yeah, very well. We are partnering with the state government. We are to enforce all the directives of the state governments in compliance with COVID-19 guidelines. It is the duty of the police to ensure the enforcement, and we are doing just that. We are partnering with the state government to ensure that the directives are carried out.
Even though the number of active cases for COVID-19 in Bayelsa State as of today is 2, the Director of Public Health in the state believes that there's more to be done to ensure that Bayelsa State becomes coronavirus-free. Hence, they have begun institutional testing.
Yeah, people are coming in to get tested, but we're not just waiting for them to come in to get tested. We're also going out and doing institutional-based testing. Like I told you, we're going to the motor parks, we're going to work premises. Most of all of these private firms in the state, most of them are responding. We're going to those places, We're going to also thinking of doing churches, the mosques, as well as even the markets and any other gathering. So because we have a target to meet in terms of testing, so we are expanding all our horizon to ensure we're able to get enough samples. And that is what is going to give us the data we're looking at that will tell us, where we are in terms of response in the state.
From Yenagua, Dobra Timiwood for COVID-19 updates.
Since Nigeria recorded its first case of COVID-19 at the end of February, the Pharmaceutical Society of Nigeria has been one of the associations in the forefront of finding solutions to the global pandemic by advocating for vaccines and therapeutics that will help tackle and cure the virus. The president of the Pharmaceutical Society of Nigeria, Sam Ohuabunwa, was in Owerri, the Imo State capital, and in one of a series of meetings with scientists, pharmacists, public health professionals, and biotechnicians, our correspondent, Tokwe Kutei, was there.
As scientists around the world race to manufacture vaccines against COVID-19, the president of the Pharmaceutical Society of Nigeria, Sam Ohuabunwa, wants Nigeria to collaborate with other African countries to come up with effective vaccine institutes in collaboration with pharmaceutical companies so as to reduce Africa's dependence on foreign aid to tackle infections like COVID-19. Mr. Ohuabunwa disclosed it while meeting with some group of scientists and public health professionals in Owerri, the Imo State capital. He says Africans need to begin to discourage over-dependence on foreign aid in the healthcare system.
Now, what should be done is that we set a lab. Nigeria had a lab in the 70s, 80s that was producing vaccines. The lab closed. As we speak, effort to revive it has been ongoing for N years, where N is not less than 10. So perhaps the way to do it is for government to understand that COVID-19 has shown us that we can't continue to depend on third parties or foreign nations. In fact, the vaccines people are making now have been paid for. Trump has paid for the vaccines, Pfizer, AstraZeneca, and other companies are trying to make. So we're waiting for it here. I said we're going to take Russian one, which nobody's sure.
He also shares his opinion on necessary measures needed to be put in place in schools ahead of the resumption.
As long as we can maintain information in the school, there's a proper toilet, we're hand washing, hand sanitizing, and that we can create gap, to maintain some level of social distancing. We have an equipped ambulance system, and then a dispensary where can be given first aid before they can be referred to a hospital. As long as those things are set in place, then schools can begin to reopen.
We'll continue to bring you up to speed with events and happenings around here as it concerns COVID-19 pandemic. From Owerri, the Imo State capital, Tokwe Kutei for COVID-19 updates.
Outside our shores, as South Africa prepares to move to level 1 lockdown on Monday, the 21st of September, the country has crossed the 4 million mark for number of COVID-19 tests done. Latest figures show that 2,055 new cases have been recorded in the last 24-hour period and 85 more deaths recorded. This has moved the COVID-related death toll to 15,857. International flights to and fro South Africa are expected to resume on the 1st of October, but there will be a list of restricted countries based on their COVID-19 status. Speaking at a media briefing today, the Minister of Cooperative Governance and Traditional Affairs, Dr. Nkosazana Dlamini, says the list, which will be adjusted according to changing COVID status of countries, is yet to be published.
The ministers concerned will table the list of the countries that still have high numbers. But of course, they'll have to work with the Minister of Health to ensure that the countries are properly identified. And they will publish them. And when they come to do their press conference, they'll give you the exact dates. I don't know what the exact dates, but it will be before we start traveling. Ideally, it should be before we get into level 1. But remember that this is not a static list. It's a list that will be changing all the time, depending. Some countries may start with low infections and go up. Some will be up and they will go down. So the list will be the schedules will be changing. It won't be just a once-off schedule. Those who have long-term visas will be now. Those visas are activated from the 1st of October. They should be able to utilize their long-term visas.
Britain's Prime Minister Boris Johnson says a second wave of COVID-19 is, quote, inevitable. And while he does not want a second national lockdown, the government may need to reintroduce restrictions. Prime Minister Johnson's warning follows new COVID-19 measures introduced for large parts of the country after a surge in cases. Meanwhile, Israel has entered a second nationwide lockdown, becoming the first country to impose one. Here's more on this and other developments on our COVID-19 Global Update.
The Jewish New Year is traditionally a time for big, festive get-togethers. But a new COVID-19 lockdown means celebrations in Israel will be muted. Under the new restrictions, Israelis must stay within 1 kilometer of their homes, with exceptions for activities such as commuting to work, shopping for essential items, and walking outdoors for exercise. Social distancing rules also greatly restrict numbers allowed in synagogues.
Israeli National Police are implementing a full lockdown across the country from the north to the south. Inside cities and different neighborhoods, more than 7,000 police officers involved in implementing health measures, preventing movements of up to 1 kilometer. And these rules and regulations will continue until the 11th of the month, in another 3 weeks' time, in order to prevent the spread of COVID-19 across the country.
With the new COVID-19 cases in Israel reaching over 6,000, a record high on Thursday, it has one of the highest infection rates in the world. Meanwhile, with cases spiking around Europe, some areas are implementing new restrictions to fight the pandemic. The British government has announced further restrictions for certain parts of England, including the Northwest, West Yorkshire and Midlands, to tackle rising COVID-19 infection rates. Residents from these areas will be banned from socializing with people outside of their households and support bubble from Tuesday. Health Secretary Matt Hancock says that UK faces a very serious situation and does not rule out another lockdown.
Well, we have seen an acceleration in the number of cases over the last couple of weeks, and we've also sadly seen that the number of people hospitalized with coronavirus is doubling about every 8 days. So we do need to take action.
And in France, local authorities in Nice have banned public gatherings of more than 10 people on beaches and in parks as part of the new measures to fight the spread of the virus. All bars and restaurants will have to close their doors at 12:30 a.m. and all visits in public care homes have been suspended. The World Health Organization has warned that the coronavirus cases are surging alarmingly in Europe, and weekly cases are now more than those reported at the peak of the pandemic.
As we've just been told, COVID-19 isn't going anywhere, and we need to continue to comply with the protocols. Do not ignore signs such as a sudden loss of taste or smell, a cough or fever. This may all be indicators of COVID-19. That's our package tonight. You can take a closer look at some of our stories and indeed stories on COVID-19 and indeed other topics. Go to our website, channelstv.com. There you find the details of all the stories. Indeed, the protocols just mentioned are also there. All that is required for you to get a better understanding of COVID-19 and what you require to stay safe. We'll be back on Monday at noon and then at 6 and 9 with fresh packages of the COVID-19 update. I'm Ladi Akere Duluale. Do have a good weekend ahead and do stay safe.